Hi, my name is Sarah. I'm going to be doing a head-to-toe assessment on you today. Can you please tell me your name and date of birth?
Hadley Hawkins, May 30th, 2001.
All right. Do you have any allergies, Hadley?
Nope.
Okay, great. I'm going to go ahead and perform hand hygiene. I would also put on gloves, but I don't have any. So you already told me your name. Can you tell me what the time is?
1:30.
All right. And can you tell me what the date is?
May 3rd, 2021.
And who the President of the United States is?
Joe Biden.
Okay, great. Hadley, are you in any pain now whatsoever?
Nope.
No? Okay, good. So general assessment right now, patient is alert and oriented ×4. Behavior-wise, they have good hygiene. There's no signs of odors or any dirt, anything like that. They are cooperative and calm. And there are no signs of agitation. All right, so moving on to the head and neck assessment. Are you in any pain within your head and neck region?
Mm-mm.
Nasal blockages?
No.
Okay. Any signs of drainage within your eyes, ears, nose, throat?
Nope.
And any changes within your vision or hearing?
No.
Okay. I'm going to go ahead and take my pen light and inspect the eyes real quick. All right, pupils are pearl, conjunctiva is pink and moist, and sclera is white and moist. Go ahead and open your mouth, stick out your tongue, lift up your tongue, and smile. Okay, great. There's no signs of abnormalities within the mouth region. Ears are both bilaterally symmetrical. Eyes are bilaterally symmetrical. I'm going to go ahead and palpate your head. Is that okay?
Mm-hmm.
All right, no signs of tenderness or masses. Hair is evenly distributed on the scalp. Eyebrows and eyelashes are also bilaterally symmetrical. Now moving on to the thoracic assessment. Have you had any changes, any difficulty breathing? Okay. Any wheezing, snoring, coughing up sputum?
No.
Chest pain?
Mm-mm.
Any heart racing?
Nope.
Okay, good. So looking at the skin right now, everything is smooth, dry, intact. No signs of discoloration. Do you mind if I just take a closer look? All right, musculoskeletal structure is symmetrical, even no signs of abnormalities or deformities. I'm going to go ahead and check skin turgor. All right, no signs of dehydration. I'm going to go ahead and listen to your heart rate at Erb's point, okay? Just for 1 minute. Alrighty, so I have Erb's point heart rate is 88 beats per minute. I also got respirations. Those are 16 per minute. Those are both within normal range. I'm going to go ahead and palpate your carotid arteries. Okay. Carotids are at a +3. They're not bounding. They're just very strong. And I'm going to go ahead and palpate your lymph nodes, okay? So preauricular, postauricular, occipital, tonsillar, submandibular, Mental, anterior cervical, deep cervical, posterior cervical, supraclavicular, and infraclavicular. Alrighty. Unable to actually feel the lymph nodes, which is normal. They're not hard or swollen or anything like that. Alright, so back to the chest. I'm going to go ahead and listen to some breath sounds, okay? Alright, listening to bronchovesicular. Go ahead and breathe in. Alright, breathe in. And breathe in. Breathe in. Alright, and listening to vesicular up here. Breathe in. Breathe in. I'm going to go under your tank top.
Okay.
Breathe in. And breathe in. Alrighty. Breathe in. Breathe in. Breathe in. And breathe in. Okay. No abnormalities within the breath sounds. Go ahead and turn around, and we're going to do the same thing posterior wise. All right, just going to look at the skin and muscle structure here. Alrighty. All right, starting with bronchovesicular. Go ahead and breathe in. Breathe in. Breathe in. Breathe in. All right, moving on to vesicular. Breathe in. Breathe in. Breathe in. Breathe in. Going under the tank top. Breathe in. Okay. Breathe in. Breathe in. And breathe in. Alrighty. You can turn around now. Alright, all breath sounds were clear. There were no signs of crackles, wheezing, anything like that. Alright, moving on to the abdominal assessment. Have you had any changes within urination, appetite, or bowel movements?
Mm-mm.
Any pain within the abdominal region?
No.
Okay, go ahead and lay back for me and lift your shirt. Alright, just gonna inspect your skin here. Okay, I'm gonna go ahead and listen to your bowel sounds in all four quadrants, starting with the right lower. Alrighty, left upper and left lower. Alright, bowel sounds are normal active. No signs of abnormalities. I'm going to go ahead and palpate now. So palpating the right lower abdominal quadrant and right upper, left upper, and left lower. Okay, good. No signs of tenderness or masses. Abdomen is flat. Skin is smooth, dry, and intact and uniform in color. And was any of that painful for you?
No.
No. Okay, go ahead and sit up. And pull your shirt down. Okay, and then I'm just gonna. All right, AP ratio of the chest is 1 to 2. And there is an ease of movement when she is breathing. Alrighty, so we're gonna move on to the upper extremities. Do you have any pain in your arms?
Mm-mm.
Any weakness, muscular weakness, limitations in range of motion?
Nope.
And any changes in sensation?
No.
Alright, so just gonna go ahead and palpate here. Looking at the skin. I'm gonna go ahead and grade your brachial pulses. Good, and radial pulses. Now checking cap refill on all 10 fingers. Good. Alrighty, good. So brachial and radial pulses, they are all +2 bilaterally. Cap refill on the fingertips are less than 3. I just want to assess your strength and motion, so go ahead and push against my hand with your arms. Go ahead and push, good, and push up, down, and just with the strength of your wrist, up, down. Okay, strength is a +5, no signs of abnormalities, deformities, no signs of weakness or limitations in range of motion. Moving on to the legs. Lower you here. All right, so just looking at the skin, looking at the muscular structure, palpating. All right, everything is good. Checking for edema. All right, no signs of edema. That is good. Gonna go ahead and palpate the posterior tibial pulses. Those are at a +1. They're there. They're just kind of hard to feel. They are bilaterally symmetrical. And dorsalis pedal pulses. Again, those are a +1. They're a little more difficult to feel, but they are there, bilaterally symmetrical. And then same thing with the arms. Have you had any limitations in range of motion? Weakness within the muscles, changes in sensation, any pain within the legs?
No.
Okay, good. I'm going to go ahead and check cap refill on the bottom here since you have polish on. Alrighty, cap refill is less than 3, so that is good. Alrighty, so overall assessment for the patient. Starting at the head, the hair is evenly distributed. Facial features are bilaterally symmetrical. No abnormalities or deformities within the eyes, ears, nose, or throat that I saw. Skin turgor throughout the body is uniform in color. There's no signs of swelling, no jaundice, no pallor. There were no tenderness or masses, no signs of abnormalities or deformities within the skin structure, the musculoskeletal structure by any means. Pulses were bilaterally symmetrical. Again, no signs of swelling or edema in the lower extremities, clear breath sounds, and normal active bowel sounds, and everything is within defined limits. Do you have any questions about your assessment? Okay, good. I'm going to perform hand hygiene again and leave you in a safe space.
Okay.